Hello, good morning.
Morning.
I'm Dr. Beela, one of a children doctor over here. Am I talking to Mrs. Bank, mother of Josie?
Yes, doctor, it's me. I'm waiting for you for so long in the queue.
Okay. I'm sorry that you have to keep waiting for me, but I'm here to discuss about Josie's condition. Is that suitable?
Yes, doctor. That's why I'm
Okay.
sitting here.
Yes. So, how is Josie doing, and how are you doing?
Oh, doctor, he just made my life in miserable. I'm just roaming in a home like a mad woman. He's passing his stools, I think, more than 10 times. It's very
Oh,
difficult to.
I can see that you're having difficult time, and that's why I'm here to discuss how we can help Josie. So, before I start, do you want anybody else to attend with us?
No, doctor, it's okay. You can start.
Okay. So, may I know that what do you know so far about Josie's condition, health condition?
Yeah, doctor, I already told you that she has been passing a lot of poo, and it's very difficult for me.
Hmm.
It's passing, some a mixed type of food. The poo, it's very smelly. It's very awful condition for me also sometimes.
Oh, yes, I can see that you're very much concerned about his condition. So, we have evaluate Josie's condition and all his blood test and his stool test, and we come to know that he is going through a condition which is known as toddler's diarrhea. So, have you ever heard about this name?
Diarrhea? It's mean diarrhea? No, doctor.
Yes. So let me explain in a bit more easy way that it is a harmless condition in which children of 3 to 5 years of age they continue to pass loose stools along with some undigested food in it. So this condition is known as toddler's diarrhea. Am I making myself clear?
No, no, doctor, I'm not getting you. How can you say that this is harmless condition? A child is passing his food more than 10 times, sometimes 7 to 8 times. So, are you sure that there is nothing to worry about that?
I can see that you are a very concerned mom. But let me explain you more about this condition. So you will come to know that we just have to do some measures to help Josie. How does it sound to you?
You said that it is harmless condition. Now you're saying that you will do some measures. So, doctor, I am very, I am very, very, very perfectionist. I am giving her very, healthy diet, and she is having that type of problem. Why, doctor? Do some test, more test.
I can see that it must be so stressing for you to manage a child with 10 stools, and I can see that it is difficult for a concerned and caring mom like you. But the test we have already performed the basic test and they all are normal, and the growth of the Yossi is also going fine, so there are no need to go for further testing, as this is a condition which can be resolved by the help changing of his something in his diet.
What do you mean by that? I'm not taking care of her properly.
You're taking very good care, but you can modify some of the diets,
Like,
and as the Josie is consuming some more like sugary drinks, some juices, so and also some more fiber. So this need to be omitted out and decrease in his diet. So it is going to help him improve his diarrhea.
okay, what else I can modify in her diet?
Yes. So you can just give him some food like common food, simple foods like wheat, some porridge, but avoid giving him some juices, chocolates, and candies.
When she will overcome the situation, doctor?
Definitely, because the sugars they will aggravate this condition, and he will improve this with the passage of time.
At what age she will overcome the situation?
It is different in different children. It is exact. I cannot exactly tell you the age, but usually in a period after 5 years, children they come out of it.
Can you give me the guarantee that she will overcome this situation?
At this point of time, there are no symptoms suggestive of any serious condition going on.
Mm-hmm. Mm-hmm.
And in a healthy children like Josie, they are
Mm-hmm.
usually, most of them, they will come out of it.
Okay.
Are you
Oh,
with me?
yes, doctor, I'm with you.
Do you have more concern and questions?
Yeah, doctor, I'm worrying about her tummy that she has some tummy pain also. So will you do some jelly scan or some other scan? It's just a request.
Mm, okay, so jelly scans, they are not going to help Josie, and it is not going to give us any more information. So it is going to be mm, actually, it is not needed at this point. If there are some symptoms suggestive to look for some other diseases,
Mm-hmm.
then we can go for it. But right now, it is not needed.
Okay. Okay, doctor. Okay.
Is there any particular reason that why you want to go for the jelly scan? Are you having any questions and concerns in your mind? Can you share it with me?
No, doctor, because she has some tummy pain, and one of my neighbor, she has a daughter, she died because of that
2 minutes
tumor,
left.
something. So that's why I'm asking to do the jelly scan.
I'm so sorry to hear about this sad news, but in a condition of Josie, it is not needed. The tummy pain can be associated with sometimes normal phenomena in a children like Josie. So I reassure you that we are with you, and we will guide you how to modify his diet. So are you agree? Are you agree to follow our plan of diet?
Yes, doctor, of course.
Okay, so Mrs. Banks, today we have discussed so many points about Josie's condition. So I want to summarize them up.
Mm-hmm.
Okay, so uh, Josie is having a condition which is known as toddler's diarrhea, and
Mm-hmm.
it is suggestive by the type of the stool he is passing, the labs we have done, and their normal and his growth. Moreover, I have explained you about the what dietary modification you can adapt to help him.
Mm.
um, um, Other than this, I'm going to refer to you a dietitian. They can help you find more recipes which you can use, healthy recipes, and modify the diet. How does it sound to you?
Yes, it's good.
Okay, so I'm going to give you some important links so you can read by your own self
Mm.
about toddler's diarrhea.
Mm-hmm.
Okay, thank you so much.
Thank you, doctor. Thank you.
Okay. So, Dr. Nida, you give feedback first, then I give.
Yeah, she did good, and she is very learned lady that I know. And but in between that, when I twisting her, she was a bit confused, or seems she had no idea. I'm asking a very weird type of questions. I know. So, but otherwise, it's okay. Good, Dr. Bila.
Thank you.
Welcome.
Can we refer in the end to a dietitian
Yeah, why not?
in this case? Okay.
Okay, so Dr. Nida asked you about that do some test. So you have to say that all tests which we have done are normal and no further tests are needed. Because in the
Okay.
stem they have mentioned celiac screen also. Okay. And then Dr. Nida asks you that can you assure me that this
Hmm.
problem will go with time? Then you told her that I cannot tell you the age when he will overcome this, but most children overcome this by 5 years. So don't confuse over there. Instead of that, say that most children with toddler's diarrhea overcome this with dietary modification, and at times without it, with time. Okay.
Okay.
And then Dr. Nida asks you that he at times complain of tummy pain. So why don't you do jelly scan for that? For that, I would have told that yes, toddler's diarrhea at time is associated with tummy pain also. And as I have already mentioned that there is no need for any further investigations. But yes, if this tummy pain is associated with throwing up, or if there is any blood in the poo, or and if it
I
is not
missed the
settling,
red flags.
and,
Yes,
and
it
if
is
it is not
important.
settling, then we may think of going for further investigations. Maybe we may also think of doing jelly scans.
Mm.
Okay.
I missed the red
And
flags. Yes, it is important
and
to
and
mention.
then you said,
I was
are you
thinking I'm
agree
missing
for?
something. Hmm?
So
Hmm.
you mentioned that are you agree? Instead of that, say that would you like to agree uh,
Hmm.
to the
Okay.
management plans which I have suggested for Josie?
Okay.
Okay. Okay.
Yeah,
Yes.
I want to comment one more thing that
Yeah.
I think we are not supposed to ask any question. The candidate
Yeah.
cannot ask. So uh, just
Then it will become
make it.
history.
Yeah, yeah, yeah.
Okay, Dr. Manish, I was a bit confused whether we have to tell about some pathophysiology of this condition of toddler's diarrhea, what it is, because in the leaflet it is written that the gut has, disturbance of
See,
absorbing
see,
and
see,
something
see.
like that.
Say why it happens. We exactly don't know. But if we make some alteration in the diet of child, then the number of poo which Josie is passing will decrease eventually.
Okay.
Okay.
She mentioned that she did not take any sugary and high fiber diet, but she should also mention that she should take high fat diet because it will reduce this total diabetes. Am I right?
See, if child is taking high fiber diet, then we will be reducing the amount of fiber in the diet. The advice should be adequate fiber in the diet. Okay. If child is taking a lot of sugary fluid daily, then we will be cutting that out. We will be replacing that with water. Okay. And we will be asking parents to increase the quantity of fat in the diet if child is not taking
Yeah.
adequately. Okay. So if they have mentioned that child is taking a lot of skimmed milk, so suggest that instead of giving skimmed milk, uh, give whole milk. Okay.
Yes.
So that you have to suggest. So you
Okay.
have
Thank
to
you.
think of fat, you have to think of fluid, you have to think of fiber, you have to think of fruit juices. So 4F you have to keep in mind. Okay.
Yes. Yes. Thank you.
So actually 4F you need to know to do this communication. Rest all you have to just speak, you have to just counsel the mother, nothing else is needed.